And good afternoon, everyone. Thanks for joining us again on Friday. I'd like to start today by acknowledging and calling out the disturbing violence that we've become aware of against Asian Americans. The recent news about the rise in hate crimes, discrimination, and violence targeting Asian Pacific Islander communities, both nationally and locally, is profoundly disturbing and shameful. From the earliest days of the pandemic here, we recognized the xenophobia, blame, and racist targeting of our Asian Pacific Islander communities. And we understand the pandemic has not only impacted the physical and mental health of so many in our community, it's also exacerbated acts of violence that can lead to further trauma for communities of color. Because racism and violence are public health issues, as health officer, I want to add my voice to denounce violent and discriminatory speech and actions, and any such actions taken to harm someone because of their race or place of origin. And we know here at Public Health that it's been a particularly difficult week for many of our community members, and I and all of my colleagues here stand in solidarity with you. Now, I'll transition to share an update on the trends in cases and hospitalizations locally. Last week's forecast was mostly sunny with a chance of rain. This week, still mostly sunny, but there are storm clouds on the horizon. As of today, there have been 85,073 cases, 5,200 hospitalizations, and 1,450 deaths associated with the COVID-19 pandemic in King County. After a drop from the peak of our large third wave, case rates plateaued in mid-February, and they're on a slight increasing trend over the past 2 weeks, with approximately 158 cases reported over the past 7 days, compared with 130 to 140 cases per day previously. The proportion of cases 65 and older decreased by 40% over the past 2 weeks. And now about 60% of our cases are in the 18 to 49-year-old range, and a full 35% in the 18 to 34-year-old range. This is in a great extent due to the success of our vaccination program protecting our older community members. We've also gone from dozens of outbreaks and hundreds of cases reported from long-term care facilities each week to no new outbreaks in the past 2 weeks, another testament to the effectiveness of the vaccines that we've been administering to our older community members. Hospitalizations have fallen to levels comparable to those before the recent third wave, with one King County resident currently hospitalized every 5 hours, or about 5 hospitalizations per day. Deaths have continued to decrease, although one King County resident is dying of COVID-19 every 8 hours, approximately 3 deaths per day during the last full week. And that's above the level we saw last summer and fall. We are continuing to see outbreaks reported. There have been about 17 outbreaks reported each of the past 2 weeks. So COVID transmission is still happening, and I'll speak more about that. There's both good news and bad news on the variant front. The good news is kudos to Washington State and to our community laboratories. As a state, and that is both the State Public Health Lab and our community labs and the University of Washington labs, we're now sequencing approximately 6% of our SARS-CoV-2 viruses from our COVID-19 cases. This is a very high rate compared to other states nationally and is above the target of 5% that the CDC has set. That's outstanding. The bad news is we're finding increasing numbers of variants each week. For King County, we've currently identified 93 cases with the B117 or the UK variant. There have been 6 cases identified with the B1351 variant, first identified in South Africa, and 2 cases identified with the P1 variant that was reported from Brazil initially. We know this more common B117 variant is more transmissible, it spreads more readily, it's more contagious than the pre-existing SARS-CoV-2 viruses, and this virus has recently been shown to cause more severe illness as well. So summarizing the recent trends, after a plateau following the third wave, we're now seeing a 13% increase in cases over the past 2 weeks. So as much as we would like it to be, as much as I would like it to be, this pandemic is not over. The risk is not gone. The virus is still with us, and more harmful variants are increasing. Current rates of transmission remain substantial, with thousands of people with infectious COVID-19 are in King County each day. Now, optimism is great and it's important, and we will be headed towards better, safer, healthier times over the coming months. But we can't let optimism blind us to the reality and the uncertainty of our situation. We're still giving the virus too many opportunities to spread right now. And increasing activity with increasing variants is a dangerous combination. We need to continue to be careful and take precautions to prevent the spread of COVID-19 in our personal lives, at work, and in the community. Vaccines have greatly reduced the threat to our most vulnerable older adults, but COVID-19 can still put a very big hurt on the rest of us if we falter now. COVID-19 is not a benign disease for younger adults. Hospitalization rates for COVID-19 are 20 times higher than they are for influenza for 18 to 49-year-olds. And as Dr. Helen Chu and her team at the University of Washington recently reported, up to 1/3 of people with COVID-19 may develop long-term symptoms. If we have too much activity without taking precautions, COVID-19 will rebound. So please remember face masks, understand the importance of ventilation, open doors, open windows, limit times with others in crowded indoor air spaces. It's incredibly important to remember how this disease spreads through the air. It floats in the air, and its risk is highest in close contact, in closed spaces, in spaces that have poor airflow. We must continue to do everything possible to increase the quality of indoor air. Now, we've also seen increasing cases associated with social gatherings, restaurants, bars, places of worship, retail and community events, coincident with the increase in cases that I described to you. For example, we've had an increase in travel-associated cases since January, from 3% to 7% of our cases reporting history of recent travel. And in that context, I want to reemphasize CDC's current travel guidance, particularly as spring break is approaching, and we know that there are multiple variants of concern present throughout the country, as well as internationally. So it's still advisable to avoid non-essential travel. If you do need to get tested before travel, 1 to 3 days before you take off. After travel, get tested again 3 to 5 days after you return. Stay home, please quarantine, and be diligent about wearing a mask around anyone you don't share a household with upon your return, as you may pose a risk to friends, family, community, and coworkers after your travel. Please remember that up to half of COVID-19 transmission occurs from people who look and appear well. We do not know that we're harboring the virus. It leaves us when we speak. It floats in the air and it can infect others. So please, the ways to reduce risk are to take precautions if you've been exposed and during travel, afterwards, quarantine, and please improve the quality of indoor air and ventilation in every aspect of our lives and our community. I want to speak a little about vaccine. As you know, starting this past Wednesday, the state moved to phase 1B2 for vaccine eligibility, and this now includes high-risk critical workers, people who are pregnant, and people with a disability that puts them at higher risk for severe COVID-19. And we're very glad to see more people eligible to be vaccinated. That's clearly where we want to be headed. But it's important to understand that the vaccine supply is not caught up with the number of eligible as these groups are expanded. So for example, the newly eligible in phase 1B2, plus people from the earlier eligibility phases who haven't yet been vaccinated, are approximately 400,000 in King County right now who are eligible and have not yet been vaccinated. On the other hand, King County providers are only receiving about 50,000 first doses per week, and that's the forecast for the next few weeks. So we're getting about 1 dose for every 8 eligible people currently. Now, we do anticipate that ratio will improve over time. We've been told that the number of doses, particularly in April, is going to increase dramatically. But everyone who's becoming eligible needs to understand that eligibility is not guaranteed access. We just are working as hard as we can to get the doses that we get out to the eligible people and to ensure vaccine equity in the way vaccine is made available. But under no circumstance can we pretend that we have the appropriate and adequate number of doses to vaccinate everyone who needs one and who's eligible for one right now. So for this reason, we will continue to work hard with our community partners to close the COVID-19 vaccine equity gap. And as I said, we do expect increasing vaccine supply, which will help us make progress on that front. We do have good capacity to distribute vaccines in King County. We can probably distribute 3 times as many as we're currently administering today. And so when those doses become available, we'll be able to get them out much more efficiently. With respect to our progress to date, over 500,000 people have received at least 1 dose in King County. That's 28% of King County residents who are 16 years of age and older, and about 1 in 7 of those are fully vaccinated. Among our older adults, we've made tremendous progress. 83% of our 75 years of age and older adults have received at least 1 dose. And 78% of those 65 to 74 years of age have received at least 1 dose. But we still see disparities among race and ethnic groups. So for example, among those 65 and older who are white, there's 78% have been vaccinated. Among Asian Americans, 69%. For Hispanic and Latinx older adults, 67%. And for our Black and African American older adults, 63%. On the other hand, our older adult residents who identify as American Indian, Alaska Native, or Native Hawaiian Pacific Islander have the highest rates of vaccination among any of the groups. We're also continuing to close the geographic gaps in vaccination rates. Among those who are 65 and older in Auburn, Kent, and Federal Way, we've seen where we've seen some of the highest rates of COVID. We now have vaccination rates that are comparable to those among older adults in Bellevue, Issaquah, and Mercer Island. And we've also seen that the highest rates in Vashon, East King County, North Seattle, and Shoreline, with first dose vaccination rates between 86 to up to 100%, whereas in the rest of the county, first dose rates are between 70 and 75%. So we've made tremendous progress, but there are still gaps that we want to close. So a couple of ways we'll be working on that this week. Our high volume drive-through and walk-up sites are in action. To date, our high volume sites in Auburn and Kent have delivered over 34,000 doses with a focus on older adults residing in South King County. This week, the King County Vaccination Partnership with Redmond reached a milestone of administering 200,000 vaccinations, many of those targeted through outreach to highest risk older adults, including home care clients and their caregivers. And last week, 3 community vaccination events took place serving the Black and African American community in Skyway, the Southeast Asian community in White Center, and older adults in Shoreline. Now, these community events by nature are lower volumes. They won't immediately close the gap, but as we continue to provide vaccination in communities, locations that are acceptable and trusted to our community members, we will continue to make progress because these are critical access points to reach people who may face barriers accessing vaccine at high volume sites or through providers in the healthcare system. These events, we understand, take tremendous resources by our community-based organization partners. It's very labor intensive to do the outreach and organization for community-based sites, and we're committed to continuing to support and increasing our support for our partners as they do this critical work. One piece of related good news is a new program launching this week in King County to provide financial support for people with economic hardships so they can successfully isolate or quarantine when they need to. So we know that when someone tests positive for COVID-19, it can bring economic hardship and concerns about how bills will be paid, especially if the person has to take time off work. So this household assistance request program will provide one-time direct payment to vendors of up to $1,500 to cover household costs, including rent, mortgage, or utility bills. Those with recent positive COVID-19 tests or who are identified as a close contact of someone with a recent positive test will be called or texted from someone in King County, one of our contact tracers, and that will start the enrollment process to determine eligibility. And I'm going to conclude by looping back to where I started today, talking about the problem of racism, violence, and stigmatization. We know that these acts can have profound impact on a person's psychological and physical health. But even without overt acts of discrimination and racist violence, we know the pandemic has and will continue to have behavioral health and emotional impacts for many of us for years to come. And this is a normal and expected reaction when people go through the stress of a natural disaster. And this has been a very prolonged and unprecedented natural disaster, which has stressed us in many ways. And our experience with past disasters has taught us that we're likely to experience phases in our emotional responses. For example, many of us may be feeling a range of emotions related to the one-year anniversary of the first cases and the first deaths locally, the shutdown of schools, and the limitations on other activities that we cherish. And we also may be feeling anxiety or other emotions related to what is to come as more and more people become vaccinated and our children head back to school in person. We know that increasing numbers of adults in our region report feeling depressed or anxious since the start of the pandemic. A statewide survey about COVID-19 impacts found over half of King County parents said their children were experiencing more social and emotional challenges and difficulties than previously. King County continues to support the behavioral health system as it adapts to the pandemic, and we support community members struggling with behavioral health conditions. And as we move towards the recovery phase of the pandemic, we will need a wide spectrum of services and supports to meet the need of our population and to prevent more serious psychological impacts from developing. Different communities and families will have different needs at different times. There's a role for traditional behavioral health services, as well as other types of holistic and community-driven supports. For example, all kids need connections to their peers and to caring adults outside of their households as they grow and develop. The distress we're seeing in our young people is an expected response to the trauma, disconnection, and disruption they've experienced this year. And our county's Best Starts for Kids initiative, which has shown great success in partnering with community to support the well-being of children, youth, and families, is leading expanded efforts to reach communities most impacted by the pandemic with innovative and community-led strategies to promote mental and emotional health. Through Best Starts for Kids, we have a robust network of hundreds of community-led organizations with deep expertise, knowledge, and connections in the communities that have been most impacted by the pandemic. These partners have already shifted their programming in response to the pandemic, adapting to provide critical social and emotional supports that kids and young people need to navigate this crisis. For example, at the start of the pandemic, Best Starts before and after school partners began meeting one-on-one with kids and their families, providing almost 9,500 one-on-one sessions to connect young people to supportive communities and programs. We're also supporting new and expanded community-oriented public health approaches to well-being, including virtual mental health supports and community conversations on topics related to stigma, grief, trauma, growth, and healing. We know the emotional impacts of the pandemic will continue to unfold for months to come, and we will continue to partner with communities most impacted to assess needs and support emotional health and well-being as we recover from this crisis. And you can look forward to hearing more from our team about what we're doing and what our community is experiencing in the coming weeks. So with that, I will be happy to turn it back over to Kate to moderate our discussion today.
Thank you, Dr. Duchin, and we'll be taking questions from media now. If you have a question, please use the raise your hand function in Zoom, and please state your name and your outlet when we call on you. First up is Elise O'Neill.
Hi, this is Alicia O'Neill with KUOW. I have two questions. The first is if you think that opening up vaccines to essential workers will help address the vaccine inequity and the higher case counts in South Seattle and South King County. And my second question is if you could talk a little bit more about what you think explains the uptick in King County's COVID cases. You mentioned a couple of factors, but I was wondering if you could talk about that in more detail.
Sure, sure, Alicia, thank you for your question. We know essential workers who have been on the front lines of this pandemic since day one, performing work that is necessary to provide us with what we all need as a community, for our continuity of operations, for food, for transit, for many essential services, have more people of color than the general population. So immunizing essential workers, offering vaccine to essential workers, both recognizes the sacrifices that they've made, the increasing rates of COVID-19 disease and severe manifestations such as hospitalization and death that have been borne by these groups and their communities where many essential workers live in our county, but also recognizes the fact that many people of color comprise essential workers, and this is an important tool to achieve vaccine equity. This was recognized by both the National Academies of Medicine and the U.S. Advisory Committee on Immunization Practices of the CDC as both ethically and risk-based strategy to use available COVID-19 vaccines in a prioritized way. So we do hope that as essential workers are vaccinated, because such a higher proportion are from communities of color, that will help us close the equity gap. With respect to why our cases are rising, there's a lot we don't understand about COVID-19. Why did our cases fall? It's all about people's behavior, and it's about the virus. And so what we know about behavior is that when people stay apart from one another, when they wear masks, when they adhere to guidelines around not spending lots of time in enclosed air spaces, and all the other precautions that are necessary, transmission goes down. And when people increase their activities, and particularly in risky settings where masks are not worn, or indoors where virus can transmit more readily, and particularly in those spaces where ventilation is not ideal, transmission will rise. Now, what's complicating that is we have new variants that are becoming the most common viruses in our community. They were expected, the B117 variant spreads more easily, which means it's more easy for someone who has the virus to spread it, and people who are in contact with that person will be more likely to catch COVID-19. That virus also tends to cause more severe disease than the pre-existing viruses that were common. Those B117 viruses are going to be most common in our community. Most likely this month. We know we're detecting more of them, as well as smaller numbers of other variants that are more transmissible as well. So the combination of people liberalizing their activities now, I think there's a lot of optimism about the vaccines, which is absolutely appropriate, but that it might be leading many people to abandon the necessary level of precautions that we need to continue for the coming weeks or a few months until more of us can be vaccinated. The vast majority of the population remains susceptible to COVID-19. The viruses that are currently circulating are more effective at spreading from person to person, and people, I believe, are engaging in more activities currently. So I think those factors are going to drive transmission up. Now, thankfully, our most highly vulnerable older adults, many of them, the vast majority, are now vaccinated. And so we should not see as many hospitalizations and deaths, even if we see a surge in younger adults and working age adults. However, I would be very sorry to see that, because COVID-19 is not a trivial disease, even for younger adults, although most people recover uneventfully. When a disease is so widespread as COVID-19 is, a significant number of people will have very complicated illnesses. Not only will it cause them to miss work or whatever activities they usually engage in, it could lead to hospitalization, rarely could lead to death, but also very concerned about the prospects of long COVID. There's a lot that we don't understand about this disease. And I mentioned the work that Dr. Chu and her colleagues have done, and others around the country and internationally have done, that suggests that a significant number of people do have long-term health effects from COVID-19. So it behooves all of us to avoid this infection, regardless of how old we are, to continue to do whatever we can do to stop the spread. It would be a shame if many people became infected over the next month or two, just as vaccines are about to become available widely to most of the population. And that would be a very preventable scenario that I would like to avoid, if at all possible.
Thank you. Next question is from Nick Popham.
Hey, Dr. Duchin, Nick Popham from Como TV. I had a question about herd immunity. I was wondering your thoughts of the feasibility or the possibility of us even reaching herd immunity now that there's more vaccine hesitancy, kids still aren't vaccinated. Do you think it's even possible that we'd be able to reach herd immunity? I've heard other doctors mention how it doesn't seem like it's going to be possible. So I was curious on your thoughts.
Yeah, thanks for the question. So let me first, just by starting out, so we're on the same page about what is herd immunity. Herd immunity is a concept that comes from animal health. And basically what it means is that the population has so much immunity that a virus cannot spread effectively. If one person becomes affected, we'll switch back to humans here. If one person becomes infected, the surrounding people are so highly immune, either due to natural infection or vaccination, that the virus can't transmit in the population. And we've achieved something like herd immunity for measles in our country, although there are pockets of unvaccinated people where that virus can spread. At least until recently, it couldn't spread widely throughout the community because so many of us have been vaccinated, and that vaccine has lifelong, long-standing, high-level protection. Now, I just want to take an aside here and talk about measles. One of the things that we've been aware of since COVID-19 happened is that a lot of people are skipping their routine vaccinations, and we're seeing increasing numbers of people missing their measles MMR vaccines. So that is going to be a real issue for us going forward. And I encourage anyone who has lapsed your children or yourself to get caught up on your routine vaccinations, particularly the measles, mumps, rubella shot. But back to herd immunity. So, Nick, I think it's probably unlikely that we will ever have sufficient immunity in the population so that COVID-19 can no longer spread at all. But I do think we can achieve a very meaningful level, population level immunity, so that our community will be protected from severe outcomes, hospitalization and death, but not likely be able to completely stop the virus from transmitting from person to person. And there's a few reasons why I say that. One is that at this time, we don't have a vaccine for children. So, you can't achieve herd immunity when 20% of the population is not vaccinated. Secondly, we would need very high levels of immunization coverage to achieve herd immunity, and that would mean of the entire population. So, maybe initially folks are thinking 70%, but because of these new, more transmissible variants, it's likely that even higher levels, maybe 80+% of people would need to be vaccinated to truly prevent any transmission from being successful, which would be herd immunity. The other complicating factor is that although vaccines are tremendously effective in preventing serious illness and hospitalization and symptomatic disease even, we don't know exactly how effective they will all be in preventing transmission. Initial data suggests they'll be very effective, but not 100%. So that's great news because that will decrease the risk, but it won't eliminate it. And then finally, we don't really know yet the duration of protection from vaccines. So it's possible that the population may need to be re-immunized in order to maintain immunity. So that is a very significant logistical challenge to continue to have a very high proportion of the entire population with a high level of vaccination coverage on an ongoing basis forever. And then finally, the virus, as it evolves and these new variants evolve, they may be less susceptible to vaccine-induced protection, and new vaccines may need to be produced, modified, like the situation is with our influenza vaccines, where the virus mutates and new vaccines are developed to meet the challenge of the newly evolving viruses. So for a number of reasons, I think that true herd immunity, meaning the absolute blockade of transmission in the population, is probably not going to happen. But I think that what is very realistic is that we will be able to achieve sufficient level of immunity through vaccination to protect our population from the most serious health effects of COVID-19, hospitalization and death. And hopefully, if people become vaccinated in great enough numbers, drive down the number of cases dramatically. It's somewhat analogous to the influenza situation, where we have vaccines each year that can prevent serious morbidity, mortality, prevent hospitalizations, but milder cases do occur, transmission does occur, and we have to live in equilibrium with the virus going forward. I think that high-level population immunity is probably more realistic than true herd immunity.
Thank you. Next question is from Glenn Farley. Glenn Farley, if you're there, you'll need to unmute.
Got me?
Yes, we can hear you.
Okay, all right. So yesterday we were hearing from the State Department of Health. Michelle Roberts was saying we're going to go from about 345,000 vaccine doses coming to the state every week. We should go to about 600,000. Obviously, the governor is opening up the categories of folks who qualify by what, 2 million statewide. You're the leader of the health community here in the largest county in the state. You have, you said 3 times as much capacity to deliver those. But what is your confidence that people will show up for that? And what is your confidence that you'll be able to deliver that, particularly through places like Lumen Field, which is growing?
Yeah, it's an important question. First of all, I do feel confident that the vaccine supply will be growing, and that we have a good system in place right now to at least currently at least triple the amount of vaccines that we're able to deliver. We can, if necessary, open up to 8 high volume vaccination sites. We know that there are over 400 healthcare providers who would like to be able to vaccinate their patients and community members, but currently only 30 of these are able to receive vaccine allocations from the Department of Health. There will be multiple pharmacy chains already. Actually, there are multiple pharmacy chains offering appointments. That will be expanded. And then increasing community vaccination events, particularly to serve hard to reach communities, will also be an important part of our strategy, as well as mobile outreach for people who can't make it to other sites, and then employer-based clinics. So we do feel confident that there's a good infrastructure to be able to handle the distribution of increasing doses of vaccine. But the critical thing to understand now is there are many, many more people eligible for vaccine than there are vaccines available. The number of eligible, the pace of becoming eligible for vaccine is greater than the pace of vaccine becoming available. So eligibility is outpacing vaccine supply right now, which is a very challenging both for people becoming eligible who then will be frustrated in trying to access vaccine, and they should understand, everyone should understand that the public health folks are just working as hard as they can to get the vaccine out as quickly as we get it, but we can't manufacture it here. We are dependent on the supply that comes to us from the federal government and through the state. And as we get it, we will make it available.
Thank you. I want to take a question we received from community members on Facebook now. Folks are interested in knowing about whether there's an issue with vaccine providers discarding doses at the end of the day.
I haven't heard of that. I certainly hope not. We ask all vaccine providers to have a rapid call-up list so that if for some reason at the end of the day they have extra doses, either because there were cancellations, people didn't show up, or because they were able to extract extra vaccine from the vials, that they start calling down those lists. And I understand it's very difficult, if you get a call that says, can you be here in a half hour, for many people to do that, but hopefully, some will. And at that point, they can administer the vaccine to someone that they call up. That is the recommended strategy to be able to use doses that might be unexpectedly available at the end of the day. I personally have not heard of people having to waste vaccine. My team hasn't mentioned it to me. So I don't think it's happening in any significant way.
Thank you. One more question from community on Facebook. Folks are interested in your take on what might happen as high schools begin to open in the coming weeks per the governor's direction.
Well, hopefully kids will start to learn in a safe environment and start to feel a whole lot better about what's going on in the world. That's my number one expectation and desire. What might happen with COVID is a little bit more challenging to predict. We do know that high schoolers transmit COVID comparable to the way adults do, and they get sick. But thankfully, rates of hospitalization and death are extremely low in young people like that, high schoolers and younger. But high schoolers may become we may see transmission among high schoolers depending on the level of precautions they're able to take, both in and out of school. One of the tricky things is, at the same time that schools are opening, a whole lot of other things are also happening in the community. Lots of things are opening, indoor activities, restaurants, dining, exercise, entertainment. All sorts of venues and things are now opening. So people have plenty of opportunities to be exposed to COVID-19 in the community as well as potentially in school settings. Now, school settings are a little different than community settings because schools take precautions. They're required to take significant precautions to protect the students and the staff before they reconvene. So the risk of high schoolers getting COVID-19 from one another in a school setting is probably lower than it would be. I should say it must be lower than it would be elsewhere where those precautions are not taking and they're gathering. And we know that high schoolers don't just go to school and then go home and isolate themselves in the rooms. They do other things. They have sports, they have extracurricular activities, they have social activities, and they partake of a lot of the other things that are now available in the community as adults do. So, I'm not sure what's going to happen. As I said, this disease is very unpredictable. We have to expect the unexpected, but we also have to, with humility, understand that we really can't predict what's going to happen. We'll be observing and monitoring as closely as we can to understand rates of disease in high schoolers. But whether or not we'll be able to draw conclusions about the role of schools remains to be seen.
Thank you. Last question from media is from Carolyn Bick.
Hi, yes, thank you so much for taking my question. Carolyn Bick from the South Seattle Emerald. I really just wanted to ask if there is an update about just because you mentioned them, the mobile teams that could potentially go visit homebound elders in their homes?
I do not have an update on that for you, Carolyn, but we can certainly get back to you with an update after the call today.
Awesome, thank you so much.
Great. And with that, that concludes questions. Dr. Duchin, any concluding remarks?
Well, again, thank you to all of you who join us on these Friday calls. I really do look forward to your questions and the discussion. And I very much appreciate the role that you're playing in getting information out to our community to help them make good decisions about how to protect themselves during what I hope are the last few months of the major threat from COVID-19. And my last words would really be that please remind people we still do have a serious threat, that we need to take precautions in all aspects of our lives, at home, at work, socially, recreationally. We can't give up on it now. As my friend Mike Osterholm likes to say, it's too late to tap the brakes after your car's wrapped around the tree. So let's try and continue to take all possible precautions and come into home plate in a good position to take full advantage of the vaccines when they become available and not experience another wave of preventable infections before that time. So thank you very much. And I look forward to seeing you again next week.